You know, the other thing I see a lot in medicine now is the breaking down of the silos between different types of clinicians.
Yeah.
And as I think about personalized medicine and what you're working on, you have the people in the lab that are really studying the gene mutation and really understanding it, but then you have the clinical oncologists and the people that are going to be on the front line dealing with patients every day. And I see these walls breaking down. I mean, I would think they have to when it comes to personalized medicine. It's not one therapy fits all anymore. Is that correct?
I think that's absolutely true. And in my own lab, I mean, I'm a MD, so I'm a physician scientist. I see patients, and then I run a lab. My lab is comprised of basic scientists, medical students, undergraduate students, people who are really just excited by, all of the biology that's happening in cancer, and really enthusiastic about working in the lab. And then I have phenomenal clinical colleagues that I work with, and we absolutely need the clinicians to bring the therapies to the patients, and obviously then we need the pharmaceutical companies in addition to help with that. So there's just a phenomenal interaction between all of these groups, and the speed at which science is translated to the clinic is really just phenomenal. If you take the example of the JAK2 mutation, which is another gene that my lab studies in myeloid blood cancers, from the discovery of that mutation to FDA approval of a drug took 6 years, which is really phenomenally fast. And I think all the time now we're seeing, biological discoveries, mechanistic understanding, targeted therapies, clinical trials. Just the speed at which those transitions are being made is really phenomenally fast. And I think this is incredibly important, because ultimately the reason I have a lab and the reason most people are involved in all of this is to try to advance the treatment for the patients that we see in the clinic, and to have better therapies that are more selective, less toxic, and that really have a big impact on the natural history of their disease.
Yeah. Well, one of the things that we do at Healthio 360, I get the opportunity to meet with a lot of different clinicians and patients and caregivers, and I have to tell you, I really admire the Damon Runyon Cancer Research Organization and everything they're doing and the brilliant minds that they're funding, because without that funding and that support, we wouldn't have the therapies coming to market. So
I could not agree more. The Damon Runyon Foundation has really been instrumental for me and for my lab. Particularly when you start out a lab, I started my lab 3 years ago, these early funding, where you're trying to build and grow your lab, and you want to extend the work that you're doing, it's just phenomenal to have the support of an organization like the Damon Runyon. So I couldn't agree more in terms of really endorsing them as people I think who are really helping to make a difference in terms of advancing treatments for patients through funding people like me and others.
Yeah. Well, please keep us updated on your research, and I wish you the best of luck, and thank you so much for stopping by.
Thank you so much for having me.
Thank you.